Hello, everyone. In today's class, we want to look at defining health. And then we want to explain why it is important to you as a future health professional. In particular, we'll be looking at what's your philosophy of healthcare and what model of health do you subscribe to. As always, here's a list of your learning objectives for those of you doing the course PECH PEC 1001. So let's start off with this question. Are you healthy? Now, that might seem like a fairly simple question, but actually, it could be a lot more complex than you think. Now, in your role as a health professional, this basically is a question you're going to be called upon to ask over and over and over again. So that's why I'm asking it. Are you healthy? And if you think you have an answer, I want you to think about, well, how do you know? Write down 10 questions that you can ask yourself or you can ask your colleague to make this determination. And try it out. Figure it out. Try it out at home. And you determine if somebody is healthy. I suspect if you do this, you won't just ask them about disease conditions or symptoms. You might start to ask them about what's the state of their mental health. You might ask them about what they eat, what they sleep. You might ask them about what kind of practices do they engage in. And therefore, you're realizing the minute you begin to think about the question, are you healthy? You're no longer simply just focusing on disease. You begin to think about a wide range of things. Now, this is important because your understanding of what health is, or your philosophy, is much like the iceberg we've been talking to you about. It represents the 9/10, and it's going to determine how you practice in your future career. Let me give you an example. For many thousands of years, there was an idea of the floor before humans being core to the health of the individuals. These four humans that were put forward inside of ancient Greece consisted of bile, blood, phlegm, and black bile. So you had yellow bile and black bile. And it was believed that health or illness was determined by the balance of these humors within your body. And therefore, the whole idea was that you wanted to keep balance. So, for example, if somebody had a fever, they would cool you down. They were trying to achieve balance. Now, this is very much in keeping with the concept of homeostasis. So, the idea of balance here makes some sense. But one of the practices that emerged out of this philosophy was the whole issue of bloodletting. That if someone was sick, they thought there would be an imbalance or something wrong with their blood. And therefore, to cure them, they would put a cut along their wrist and allow some blood to seep out, hoping to restore the balance of these four humors. And so there you see a very simple example of how your underlying philosophy of what you view health to be and what contributes to health is then going to affect how you practice as a health practitioner moving forward. Therefore, we want to look at the evolution of the definitions of health, because this isn't just something that we're having fun with here. This is something that top scientists and physicians have spoken about. And in 1948, the WHO, the World Health Organization, weighed in upon this when they said health is a complete state of physical, mental, and social well being, and it is not merely the absence of disease or infirmity. Now, this definition, more than 70 years ago, represented a major step forward. It was considered a major advance. It shifted health from beyond simply being the absence of disease into something much further, much broader. And it focused not just on physical aspects of the body, but it also brought to light mental aspects and social aspects. And so we can say this represented a step forward within the concepts and definitions of health. However, Over the years, this definition has come under widespread criticism. And we want to look at some of the criticisms and some of the concerns about this definition of health. Let's start by looking at this picture, this image. If I were to put this image up before you and I were to ask this question, are the persons depicted below in this image, are they healthy? What would you say? You could pause and you can have a conversation and a discussion. Well, on one level, what's the most obvious thing that jumps out at you? They're socializing. They seem to be having fun. There seems to be a good sense of community and relationship. They're playing a game of chess and they all seem to be engaged. And that requires a certain level of mental fitness and ability. However, it's also very obvious that these are older human beings, maybe over 60. And therefore, there's the potential that they have a chronic disease like diabetes or hypertension. So the question is, are they healthy? And that goes to that WHO definition, which spoke about complete. Is it possible to be completely physical, mentally, and socially well? And what does that mean? So for a group like this, as they age, is to be healthy to be totally absent of disease? Or is it something different? Is it something more? We're going to answer that question shortly. Well, let's look at another definition by looking at this picture. There's a very well-known actress, and many of you probably know who she is. If you don't, she's Angelina Jolie. Now, she's well known for many of her movies, but she's also famous because she decided to undergo a double mastectomy because she had a gene that put her in a category of very high risk chance of getting breast cancer. So she did not have a disease, but she decided to undergo a life-altering surgery even before contracting the disease. Now, I'm not casting any doubts upon her decision, but this, some people might argue it is an example of over-medicalization, where in the quest for complete health, we go too far and we start treating things that are not even there. Please note, I'm not saying that this is the case for Angelina Jolie. We're just using it as a discussion. So the question is, can we ever be completely healthy? And in seeking to achieve this goal, do we overtreat, over-medicalization? And that's why in the United States, where this is heavily discussed, you found that Americans filled a record of, in 2018, 5.8 billion prescriptions, almost 18 prescriptions per person a year, as they're seeking to achieve this complete health. And this has spread over into conditions like ADHD, where there's a lot of controversy. If in trying to help kids with ADHD, we might be over-prescribing instead of thinking about what are some of the other issues at play. And so you can see this idea of the definition of health is not so straightforward and can lead us into territory that can be very controversial. So because of these challenges to the definitions of health, there have been searches for better definitions. And this is part of the evolution that has taken place. So in 1984, the WHO again put out a new definition, saying that health is a resource for everyday life. It's not the object of living. Here they're now starting to focus on that issue of complete. They say it's a positive concept and it emphasizes social and personal resources as well as physical capability. Other people have said health is multidimensional. It's not merely the presence or absence of disease, but also as social, psychological, and cultural determinants. And finally, most recently, there was a large gathering at a conference in Holland who put out a paper in the British Medical Journal. And they summarized all that they said to say that health is the ability to adapt and self-manage in the face of social, physical, and emotional challenges. And so if we go back to this image that I showed you here. Health then is not the absence of the disease, it's how these persons adapted to the challenges being thrown at them as they have gotten older. And if they have adapted well and they're managing their physical, social, and mental well being, and some may add spiritual to that, is it reasonable to conclude that they are healthy? So we can then say that the quality of life is just as important as years of life, because that then is a big shift, quality of life. And now many people consider health and wellness along a continuum, and they don't just define it in absolutes. Either you're healthy or you're unhealthy. But there's a continuum upon which people can exist. And this gives us a much more nuanced and broad consideration of health. When we're talking about this, let's just talk about three terms that are often used interchangeably, but they do actually have different considerations. The first is disease. And when we use the term disease, what we're talking about here is biological. We're referring to what is the underlying process, pathology taking place within a person. This will be described by the doctor, the dentist, or the optometrist. Well, if we say that's the disease, the underlying pathology, so if someone has a cold, the disease is there's a particular virus in their body. Well, what is the illness? Well, the illness is the subjective experience that the person is telling you about. It's their symptoms. When they come to see you, they say, this is how I'm feeling. I'm feeling weak. I'm feeling tired. Or someone comes to the optometrist and they tell you, well, I seem to have double vision. That's the illness. So finally then, what is sickness? Well, sickness is the role that you begin to adopt within society because of cultural beliefs. So for example, there are certain disorders that attract a lot of stigma. In the past, HIV. Today, something like epilepsy might attract a lot of stigma. In the current pandemic of COVID-19, there might be a lot of stigma. And so sickness represents the role that you adopt in society. And so even as we're thinking about health, these three definitions are important because they help you understand how we discuss things and how we consider these things. So let me ask you another question. I'm coming to you from Trinidad and Tobago, but you could apply this to any country in the world, or you could apply it to the entire world. If I were to ask you if you could change one thing and make it better to improve health in Trinidad and Tobago, or in the country where you're sitting and listening to me right now, what would that one thing be? And why would you choose that one thing? And of course, this is another opportunity for discussion if you're in groups. And this leads us to the concept of models of health. Models of health. And we want to start off by saying that, again, these models are going to affect your role as a health practitioner. And we're building now upon our definitions of health. Now, the primary model that has dominated healthcare for the last 100 and 150 years and continues to dominate healthcare in teaching and training institutions all across the earth is the biomedical model. And that biomedical model really focuses on the concept that health is the absence of disease. Here you have a funny little cartoon. The bad news is you have a disease unknown to medical science. The good news is I'm going to name it after me. Very much focusing on the disease, not really focusing on the individual that's present. And you know, in all humor, sometimes, very often, there is a grain of truth. So let's explore the biomedical model by asking a set of questions. So the first question we want to ask ourselves is, in the biomedical model, what causes illness? Who gets diseases? Well, in the biomedical model, Diseases come from outside the body, and they're due to physical changes within the body. They're due to chemical imbalances, bacteria, viruses, and genetic predispositions. Notice the person is not responsible for the illness. It's something coming from outside of them or something that's gone deranged on the inside of them. And so if you ask the question, who is responsible? Individuals are not seen as responsible for their illness because they can't control it. That then immediately puts them in a certain position where they are regarded as victims of an external force that is now impacting upon them. And again, I want you to think about here how philosophy then shapes experience and the roles that people will begin to play. Not just the role of someone who contracts a disease, but also what's the role of the caregiver if we start to think along these lines. What are some more questions that we can ask using the biomedical model? Well, how should illness be treated? Well, if illness is a result of disease, it's a result of change, well, we want to mitigate against that change. So vaccination, drugs, therapy, all aiming to change the physical state of the body in order to treat the disorder. Now, I want you to think about this in the current context of our COVID pandemic. If I were to ask you, what's causing the disease? What's causing the illness? Well, I think the first answer, of course, is there's a virus. There is a coronavirus causing it. But if I were to push you a little bit more, what's causing it? Maybe we could say there's human behavior involved. Isn't that, in a certain way, a level of cause? Isn't that something to be thought about? If you're somebody who just goes from the biomedical model, then you're focused very much upon the virus, and you're seeking to treat it by developing therapies and vaccinations. But if you begin to expand, and we're going to see that in a little while, you'll actually think about other things, and that's where you'll see public health people talking to you about wearing masks and social distancing. In terms about thinking about what's the one thing you could change in order to improve health in your nation, I wonder what was the thing you put forward? Was it telling everybody to take a drug? Or was it something a little bit more simple, like improve access to good food or to clean water? What about a next question we can ask? Who is responsible for treatment? Well, in the biomedical model, responsibility lies strictly upon the physicians and the healthcare professionals. Not much responsibility upon the person with the illness. Now, what's the relationship between health and illness? Well, they're seen as very, very different. They're not seen on the continuum that we spoke about. Either you're healthy or you're not. Hence the aggressive drive to produce a drug or to produce a vaccination or to produce a medicine that allows you to say that disease has been eliminated. Finally, what's the relationship between the mind and the body? Well, in the biomedical model, they're seen as totally separate entities. And it's suggested that the mind cannot influence the body. And the body is seen solely in terms of its physical attributes. And so the mental aspect of health doesn't have a lot of relevance. Now, this would then affect the whole idea of when a patient comes to see you, you should be emotionally detached. You shouldn't engage the patient in a certain way because the patient's well-being and the patient's state of mind is not really that important in dealing with the disease. Those of you who have been in this course, we have spoken about Dr. Gregory House and that television program where we see that type of approach. And this leads us on to the final question. So what's the role of psychology in health and illness? And here we can say that an illness may have psychological consequences, but not psychological causes. So cancer can cause unhappiness, but it's never considered that maybe stress could then lead to a physical symptomatology. So by exploring those questions, we look at the biomedical model. And as I said before, that's something that I want you to be aware about as you aware of as you go through your training, because it still to a large extent dominates training in the health professions in the year 2020. Well, as far back as 1977, this model came under intense criticism, and it was put forward by this gentleman, George Engel. He wrote a seminal paper in which he outlined many criticisms of the biomedical model. I just want to ask you to look at a few with me. And then I'll ask you to take some time and read his paper and actually study his criticisms in more detail. So let's look at some of his criticisms. He started us by asking the question, why do people get the cold? Very, very interesting in the world of 2020 when we're living in a global pandemic. And he said, well, it isn't just because of a virus. It could be because of reduced immunity, lack of sleep, different weeks, and those types of things are taking place. Sorry, difficult weeks. You're having a difficult week. In the world of COVID in the year 2020, we could ask the question, why are some people dying from COVID-19 and others are not? And what we discover is some things have to do with the virus, like the viral load. But there are other things that are important, like obesity. But then you also ask, why are some people obese and others not? And you realize it now goes beyond simply a biomedical approach to considering that. And this has been a big topic of discussion in many countries where they now talk about health disparities and health inequalities. So his criticisms were this. He said a biochemical alteration does not translate directly into an illness. Why does one person get ill and not the other? I think the example of COVID-19 is a very, very good example. Why are some demographics getting ill and getting much more sick and not other? And we know it has to do with pre-existing conditions, but then we have to ask, where do those pre-existing conditions come from? He also said that the presence of a biological derangement doesn't really shed light on the meaning of the symptoms to the patient. And let me give an example of what I mean by this. This is a guy who falls down and he twists his knee. It's it's an injury that occurs at work. He's a construction worker, and the end result is he's not able to work for 3 months. Well, the nature of his job is if he doesn't work, he probably doesn't get paid a salary. And the nature of his job in many countries might be that he doesn't have a large amount of savings. And so that injury isn't just pain that he has to deal with, time off from work. That injury is going to affect his entire socioeconomic outlook and is going to have impacts upon his wife and his kids. Very, very different if the same thing happened to a high-profile lawyer who is then able to continue working. And even if they have to take some time off, has the ability, because of a certain financial capacity that has been earned, to withstand the 3 months layoff. That's what we're also seeing during this pandemic with lockdowns. So, for example, very easy to tell somebody, well, you have to quarantine for 2 weeks or 21 days. But depending on the nature of their work, that will have different implications. And so just telling somebody you have COVID-19 doesn't shed full light on the meaning of that for that particular individual. Again, telling somebody they have COVID-19, if you have access to all the latest treatments and all the experimental drugs, it's going to be very different from telling somebody they have COVID-19 if they don't have access to those drugs and to treatment in the hospital. Here are some more criticisms. So based upon this, it's very easy to see where Engel was going. So he said psychosocial variables are more important determinants of susceptibility, severity, and the course of illness than had been previously appreciated by simply those who put forward a biomedical view. Again, this is something that we're discovering inside of the COVID-19 pandemic. For example, unemployment is a risk factor for for cardiovascular disease. That's very interesting because unemployment has nothing to do with deranged biology or a virus or physical change. But clearly, it seems that maybe unemployment leads to stress, which can lead to hypertension, which can cause cardiovascular disease. It's a very interesting study that came out of the United Kingdom almost 40 years ago now. It's called the Whitehall Study, and it took place for more than a decade. And what it sought to do was look at 18,000 civil servants. They focused upon males to allow comparison, fair comparison, and they studied their mortality and morbidity over that period of time. And what they were able to discover was depending on your seniority within the civil service, it actually affected your mortality rate. Those who were very senior had a much lower mortality rate than those who were much junior in the organization. And so therefore, you could determine life expectancy, not simply upon a disease process, or whether you got the cold or whether you got cancer. Your life expectancy was determined by what job you did. So let me come back to the question I asked you at the beginning. And that question was, if there was one thing you had to do to improve health in your country, what would it be? And historically, one of the things we've discovered is that very often big advances in health have nothing to do with fighting disease, but they have to do with other things, like providing clean drinking water. And that allows us to get rid of diseases like cholera, as an example. Well, this therefore is what I was just saying. This was another of Engel's criticism. The success of most biological treatments is influenced not just by the biology, but there are also psychosocial factors. And we know this from the placebo treatment. You can give somebody a pill that has no activity, and it can actually work just because they believe it to be so. So psychology can affect physical processes. And there's evidence to show that if patients develop a good rapport with their physicians, and the physicians demonstrate empathy, that improves physical outcomes in diseases like diabetes and the cold. And here we have another joke. We'll just mill around till he's asleep and then send him back up. This is a placebo effect operation. I'm not sure if the placebo effect extends to that extent. And the last one I'm just going to mention is the patient-clinician relationship influences medical outcomes, even if it simply means they're going to stay and stick to the treatment. The compliance is going to be good. And this then comes to what I was just talking to you about. How can this relationship actually improve outcomes? Well, on the most basic level, if the doctor treats you well, if the pharmacist treats you well, it's probably a lot more likely that you're going to follow their advice. And again, we have another cartoon. Lady talking to her cat about how he's treating the mouth. So, based upon Engel's criticisms, this led to the emergence of the biopsychosocial model. I think you can see immediately where this is going because this lines up now with the definitions of health that we're talking about. The biopsychosocial model puts forward the fact that disease and illness is not simply as a result of a physical change or the presence of an external agent changing internal things. But when thinking about disease and illness, you have to think about, yes, you have to think about the biology, but you also have to think about social relationships, cultural issues, socioeconomic matters, what we often call the social determinants of health. And then you also have to think about psychological attitudes and psychological issues like their beliefs, their levels of stress, how it's affecting somebody emotionally, what's their emotional state. And like I said, some people would even now throw in spirituality into this model. So let's just define then what is the biomedical model. In the biomedical model, human beings are seen as very complex systems. And therefore, you can't just think of it as just one thing. In thinking about someone who has a cold, that's not a simple thing you're dealing with. This is a complex system. As a result, illness can be caused by a multitude or a combination of factors, and not by a single causal factor. So yes, you have contracted the cold, but that's not just simply because you are exposed to a virus. That's because your immunity is low. And your immunity is low is because you're not getting good nutrition. And you're not getting good nutrition because of your socioeconomic factors. And so that's why you see that complex system leading to a multitude of things occurring. Inside of this model, the client is no longer seen as being passive or victim. And therefore, the patient or the client must now become responsible for his or her health and illness and take responsibility for treating the illness. Because yes, we can give you antivirals to get rid of that virus, but then we have to work with you to deal with your socioeconomic position or your psychological position. And those things are going to be important in helping you walk through this period of time. In treating a person, we have to think about everything about that person, not just the physical changes. So in thinking about that case study of the man who twisted his knee, yes, we could simply treat the twisted knee, but within a well-functioning public health system, we need to be thinking about what are the implications and how are we going to manage that? Because let's think about it like this. If we don't manage that, chances are that that man is going to go back to work too soon. Chances are that he's going to be likely to take a risk, and there might be another injury on the job that won't only affect him maybe more long term, but it might also have implications for others. The patient has to become responsible for getting better, change their behavior, change the way they think, come up with coping strategies, change their diet. The patient becomes central inside of the process within the biopsychosocial model. Engel also strongly believed that health and illness were connected, and he would have been a proponent of this wellness continuum that I've spoken to you about. And inside of that, he thought the mind and the body could not be kept separate. And he was very concerned about the way health professionals interacted with their clients, saying that that could determine the progress or the course of their illness. So I've said all of this, and some of this you can learn on just knowledge-based consideration. But inside of this course on professionalism, I believe there's an implication for you. And there's a big shift that I want you to make. There's a paradigm shift that I want you to get, as I'm showing you in that diagram. As that fish moves from one realm of life, from one perspective, into another. I want to encapsulate that shift by playing a little movie clip for you. This is from the movie Patch Adams. So let's just enjoy this clip together.
You've been accused of practicing medicine without a license. It's a very grave charge, son. Are you aware that it's unlawful to practice medicine without a medical license?
Yes, sir, I am.
Are you aware that running a medical clinic without the proper licensing can place both you and the public in a great deal of danger?
Is a home a clinic, sir?
If you are admitting patients and treating them, physical location is irrelevant.
Yes, sir. Will you define treatment for me?
Yes, treatment would be defined as the care of a patient seeking medical attention. Have you been treating patients, Mr. Adams?
Well, sir, I live with several people. They come and go as they please. I offer them whatever help I can.
Mr. Adams, have you or have you not been treating patients at your ranch?
Everyone who comes to the ranch is a patient, yes. And every person who comes to the ranch is also a doctor.
I'm sorry.
Every person who comes to the ranch is in need of some form of physical or mental help. They're patients. But also every person who comes to the ranch is in charge of taking care of someone else, whether it's cooking for them, cleaning them, or even a simple task as listening. That makes them doctors. I use that term broadly, gentlemen, but is not a doctor someone who helps someone else? When did the term doctor get treated with such reverence as, oh, right this way, Dr. Smith, or, excuse me, Dr. Scholes, what wonderful foot pads, or, pardon me, Dr. Patterson, but your flatulence has no odor. At what point in history did a doctor become more than a trusted and learned friend who visited and treated the ill? Now, you ask me if I've been practicing medicine. Well, if this means opening your door to those in need, those in pain, caring for them, listening to them, applying a cold cloth until a fever breaks. If this is practicing medicine, if this is treating a patient, then I am guilty as charged, sir.
Did you consider the ramifications of your actions? What if one of your patients had died?
What's wrong with death, sir? What are we so mortally afraid of? Why can't we treat death with a certain amount of humanity and dignity and decency and, God forbid, maybe even humor? Death is not the enemy, gentlemen. If we're going to fight a disease, let's fight one of the most terrible diseases of all, indifference. Now, I've sat in your schools and heard people lecture on transference and professional distance. Transference is inevitable, sir. Every human being has an impact on another. Why don't we want that in a patient-doctor relationship? That's why I've listened to your teachings and I believe they're wrong. A doctor's mission should be not just to prevent death, but also to improve the quality of life. That's why you treat a disease, you win, you lose. You treat a person, I guarantee you'll win, no matter what the outcome.
And that's the quote at the end of that clip there. You treat a disease, you win, you lose. You treat a person, I guarantee you'll win, no matter what the outcome. And that's a movie that you might find interesting. It's an old movie, but it's very funny. And I'd encourage many of you to watch it. What's being summarized in that last clip, which is quite poignant, is again the difference between a biomedical approach and a biopsychosocial approach. When you take a biomedical approach, it's a kind of all or nothing. Either you win or you lose. But you see a biopsychosocial approach being much broader. And the issue being that you don't simply treat the disease, but you're taking care of and you have concern for the person. And so that's the shift that I want you to consider. A shift from being disease-centered health practitioners and health professionals to focusing on the fact that you are now patient-centered. And there's this joke that's well known, especially in medicine, that a patient is firstly a person. Often you might see a ward rounds happening and somebody refer to the appendix in bed 3. And the response is, I don't know about appendix, but the person is doing fine. Thanks, I like to be respected for being me. So that's the shift inside of this entire lecture that I've been speaking to you about. That's a shift I want you to consider. What is your definition of health? What is your philosophy of health? And how is that going to affect you as a future health professional? And I hope you see the value of shifting from being disease-centered to patient-centered. So until next time, take care.